Hello, and welcome to this presentation. We will be discussing the role of precision medicine and artificial intelligence and how we can use them to leverage better healthcare outcome for our patients. Okay, so we are going to get started with a quick definition. So precision medicine and personalized medicine are terms that are sometimes used interchangeably. Their approach aims to use genetic, environmental, and lifestyle information to guide decision about a person's health. This is typically done to help formulate a more accurate treatment and prevention strategies instead of having a one-size-fits-all approach to healthcare. Some of the benefits of precision medicine include using one's genetic information as part of routine medical care, better understanding of why certain diseases occur, predicting which treatment would work best for the patient, and it also provides a holistic approach to diagnosing and treating diseases. So the type of data that we would want to collect here are genetic information through laboratories, on genetic testing. So we would be getting genomic sequencing, we'll find hereditary risk or genetic variants. We will get imaging studies and blood work as well. We'll be getting lifestyle and behavioral data like patients' diet, nutrition, physical activity, and any substance use. Would also be getting environmental and social data, like if the patients live in an area with a lot of pollutions or their allergens, their income, housing, and healthcare access. And then would also be receiving patient self-reported data, like their general well-being, symptoms they may be experiencing, mental health symptoms, sleep quality, stress levels, and any current medications and therapies that they may be undergoing. So for data collection and security, first and foremost, we will want to receive informed consent from all participating patients. So we will draft a form that would explain to the patients the purpose of our data collection, how the data will be used, and the privacy measures that we will employ to maintain the private health information security. Patient also will have the option of opting out if they choose to not participate in this. For the privacy, we want to ensure that we have compliance with HIPAA regulations and other regulatory laws to ensure that our EHR system is HIPAA compliant. We want to do data encryption, perform data de-identification so we can mask any kind of personal identifiable factors in it. Also, we want to maintain logs of who has access to the data and when they have access to said data. Furthermore, we want to obtain medical histories through the EHR system. We want to get vitals, height, weight, and other metrics like that, as well as past medical history during the visits. And we can also do this virtually or through telephone interviews. We also want to do online mobile questionnaires through our secure portals, or again, face-to-face or through telephone interviews. We'll be encrypting files for transfer genetic information and other lab results. We'll implement firewall to protect network information. We'll have double authentication login for our clinicians. And we can also use cloud computing as an add-on to the EHR systems. This will allow us to share information through like renting a space, essentially. So patient can put in their self-reported data through a cloud-hosted portal. And then the cloud can also be used to back up PHI as well as information recovery. And overall, it will just improve functionality without needing the need for us to purchase a brand new system. So furthermore, for data security and privacy, the patient data will be safely handled through the secure portal, like previously mentioned, or through a cloud-hosted portal. We'll do data de-identification to mask personal details. The staff will be trained on HIPAA rules and security practices. We'll develop procedures to report any data breaches or security leaks so we can tend to them quickly. We'll encrypt all the PHI data, both in transit and in storage in the system. We'll do regular backup of PHI and also secure disposal of any unused data. And we'll frequently perform risk management to identify any vulnerabilities in handling PHI. So what type of patients will benefit most from this implementation? So patients that are suffering from chronic conditions like diabetes, cardiovascular diseases, or other respiratory diseases will be a great fit for the implementation. With precision medicine, as previously mentioned in the definition, we can provide personalized treatment based on genetic, environmental, and lifestyle factors, while AI can provide recommendations and targeted interventions. Another group that kind of fits into the chronic group sphere are elderly patients, which I think will be very beneficial for. With AI and precision medicine, we can help reduce polypharmacy and identify which medication would be the most effective for managing their symptoms. We can also help monitor the condition, the risk factors, and also help with early detections of illnesses like dementia and Alzheimer's. Another group that would benefit from this implementation of patients that are interested in preventative care. If they have, heart diseases or certain cancers that run in the family, this will be a good way to identify any genetic predispositions. So in terms of the treatment plan, we want to gather all the required data that we've previously discussed, that we would get from laboratory tests, imaging, genomic testing, lifestyle, and other self-reported data from our participating patients. And then AI will analyze the collected data to identify any patterns, correlations, risk factors, and it will additionally predict disease progression, treatment efficacy, and potential side effects. And then collaboratively, the team will review the AI-generated insight with the patients to discuss the findings, tailor a plan of care for the patients, considering their medical history, genetic predispositions, and their personal preferences. And following that, patients will receive the tailored plan of care. They'll report back to us on how well the plan is working for them, any changes in their symptoms and overall quality of life. And then AI will continuously use the feedback that we receive from the patients to track the progress and make necessary changes. So now for staff training, things that we want to make sure that we hit are, first of all, we want to define the goal and the potential for improving patients' outcomes with precision medicine. We want to explain the AI's role in predictive analysis and how it will support diagnosis and provide treatment recommendations. We want to train staff on the importance of accurate data collection and EHR inputs to support the AI algorithm. We'll also train staff on how to navigate the AI technology, how to interpret the insights and apply the recommendations. We can also do in-services so the staff can practice this new implementation. We'll review the potential for biases in AI system and the strategies on how to handle them. We'll also provide staff with techniques on how they can discuss precision medicine and AI-supported decisions with the patients. We can also make pamphlets so patients have a reading material that they can go home later on and review so they can better understand the goal of our intervention. We'll also review, of course, the importance of maintaining patient confidentiality and adhering to HIPAA regulations. And we also want to make sure that we encourage staff to seek support from the educational department if they feel like they need more support. So in terms of patient monitoring, how we want to collect the data from our implementation is we want to set up virtual meetings or in-person meetings with patients, whichever one they prefer, so they can update us on the changes in the well-beings, their symptoms, any side effects that they may be experiencing, and the overall treatment adherence. We want to obtain metrics like the vital signs, blood sugar, and then other metrics of the sort. We can get to that in office for the patients that decide to come in, or they can do those at home and then upload them through their patient profile for us to collect. So we'll be collecting that data through the patient portals, and then the AI system will analyze the obtained data, detect any abnormalities, or predict complications if there are any. Alerts can also be deployed, for to let us know if there's any changes that arise so we can quickly intervene. Then we'll review the feedback with the patients and determine if the medications or other therapies that they may be undergoing need to be updated. We'll also continue to perform regular case reviews to assess for the patient's progress. To assess the outcome of our implementation, we will assess the metrics that we collected pre-implementation and compare them to the ones that we obtain after the implementation to look at the changes that arise. So we also want to use statistical analysis to assess for the plan of care success or failure. So we can use analysis like t-test, ANOVA regression model, or mixed effect model. We also want to adjust for confounding variables like new treatment options introduced, changes in insurance that would affect patients' healthcare access, or any significant changes in the severity of a patient's illness that will require a brand new plan of care. So the type of feedback that we can expect to receive from patients, we can expect satisfaction with the new plan of care and noticeable improvement in their symptoms. Appreciation for a personalized plan of care that's tailored to their unique needs. And some negative feedback that we may receive or maybe concerns about the use of AI system for treatment recommendation, or even difficulty understanding or approach with AI-driven recommendations. From staff, we can get feedback like satisfaction with the use of technology to improve design of patient's care plan, appreciation for a comprehensive approach and holistic approach to patient's plan of care. But then there may also be concerns about, AI biases and how they affect recommendations, difficulty with understanding how to interpret the AI recommendations, the learning curve with the new system, and then maybe also perceive increased documentation burden from all the input that the staff will have to put in. For public awareness, after we've analyzed, all our data, and we've determined whether or not implementation has been successful, something that we can do to kind of share our results with everyone is we can organize conferences and webinars for other clinicians, researchers, community health groups, patients and the families to attend. So again, we can present the results of our implementation. So we want to present an overview of precision medicine and the role it plays in personalized care, AI's application and its role in trend analysis, diagnosis, and treatment planning, security measures in data collection that we've employed along with real-life success stories from our patients. We also can have a Q&A session at the end so the attendees can ask any unanswered questions that they may have. And we can also provide information for any future participants if they would like to, participate essentially in this healthcare approach that we have come up with. So that is all I have for this presentation. Thank you again for tuning in.